Well, hello and welcome to all of our viewers this evening. On behalf of Roanoke College, I welcome each of you to the series NOKELive from Washington, D.C. It's Healthcare Night. My name is Brian Parsons, and I'm Associate Professor of Political Science and the Chair of the Public Affairs Department. One of our co-hosts this evening is my colleague, Dr. Shannon Anderson, who is Associate Professor of Sociology and the coordinator of the Public Health Studies program here at Roanoke. This event is co-sponsored by the Office of Alumni and Family Relations, Sociology and Public Health Studies, and Public Affairs. Before we get started, please know that each of you viewing via YouTube can use the chat feature to ask questions of our presenter. Once the presentation is complete, Dr. Anderson and I will select and ask as many of your questions as possible. Tonight's event is being recorded and will be available on this YouTube channel for future viewing. A link to our past NOKELive events, as well as other online content, can be found at the Alumni Hub at roanoke.edu/alumni. This evening's NOKELive topic is healthcare on the Hill. This is part 4 of a series with Dr. Rodney Whitlock, a Roanoke College graduate from the class of '87. Dr. Whitlock has gained over 25 years of experience on the Hill, working in both houses of Congress in the area of healthcare policy. During his tenure, he managed the Patient's Bill of Rights, served as the lead Republican staffer for Medicaid legislation from 2005 to 2010, and helped staff Republicans in the Senate on such prominent and important legislation as the Deficit Reduction Act, the Tax Relief and Healthcare Act, the CHIP Reauthorization Acts, and the Affordable Care Act. For the last 20 years, Rodney has been an adjunct faculty member at the George Washington University Milken Institute School of Public Health in the Department of Health Policy and Management, and the Graduate School of Political Management in the Department of Legislative Affairs. It is now my pleasure to turn it over to Dr. Rodney Whitlock to introduce our guest and begin tonight's presentation.
Well, thank you all for having us again. It's been a fun year doing this. We started out with Seth Gold, with Senator Portman, then went to my friend Lauren Aronson, who'd done some time in the White House and in CMS, and is now on the outside with Melvin Castanetti, and then had Carlos Jackson from the America's Essential Hospitals. And so we've gotten a number of different perspectives from people inside the legislative process, and then people who've been on the regulatory process, and then some folks who've been straight on the advocacy process. And so for the fourth and the final one in the series this year, the place I thought would be very interesting for us to go is the press, because they play a significant role in what we see. And where I thought one of the best people I could think of for this is Paige. I'll go do the Winfield Cunningham, because I remember that. And Paige works at the Washington Post. She leads a health newsletter called the Health 202. Go to your website, find it. You need to read it. You know why? Because everyone in Washington who plays in healthcare does. It's where we start our days with what Paige has to say. And so Paige is right there at the forefront of the process every day. And we'll talk about the role that the press has in healthcare, et cetera, as we go forward. So Paige, thank you so very much for being with us here tonight. I'm not actually back at Roanoke. I'm still in my basement in Arlington, but I do so love being able to put that photo up behind my head.
Well, Rodney, thanks for having me. Happy to join, and thanks for inviting me. I know you've always been so helpful to me in my years covering health policy, so looking forward to this conversation.
So as we've discussed these, we start on the policy side. And so you have the challenge of trying to communicate policy to your readers, which means you have to discern right from wrong, and what you think is accurate, what you still have questions about. And for me, the place to start is you've had to do your job in one of the most difficult times one could possibly imagine. A global pandemic in an extraordinarily partisan world where, let's face it, at times we have been in what we refer to as the post-truth atmosphere, where we really do question what is true and not on a day-to-day basis in Washington. And we saw that throughout much of 2020 in the midst of, again, something we hadn't seen in this country in a century. So let's start there. I mean, how challenging was it for you to really think about what you report as what you thought was accurate as you talked about the COVID pandemic?
Yeah, that's a really good question. And you're totally right that it's been a really, really difficult year. And it's funny because, like, when I talk to family and friends, they'll have a lot of criticisms of the press of how we've covered this. And it'll make me really defensive on one hand, because, and I'll say why. And then there are also, I think, some legitimate criticisms as well. But I think I would separate the challenge into two buckets, really. The first is scientific. And, like you said, none of us had experience in covering a pandemic before. So we don't have a framework for this. And I'm not a science journalist per se. I don't have a background in science. It's really been policy that I've covered. But I've really been forced to kind of delve into the science and kind of the evolving knowledge of how we know how the virus spreads and how it travels and how it works, and, the treatments that are being used on people, because of course, all of those things are affecting the policy decisions that are being made. And that's been a real challenge. Obviously, we have a very different understanding of the virus now than we did a year ago. And I do think, like, public health agencies, generally speaking, have been pretty slow to kind of adapt to, like, new things that we've learned about the virus. And I think sometimes the press is a little bit slow to do that as well. But it's really challenging because you're operating off of a set of assumptions, in March 2020, and you're operating off of a different set of knowledge now. Some of the things, like in terms of, that we've learned about how the virus transmits is one thing. Obviously, I was remembering recently how, I think at my workplace, the last week before we had to go home, we had, like, signs everywhere saying wash your hands, and we had all of these graphics showing, like, how many times people touch their face in a given day. And not that those things aren't useful, but we've since learned that it's mostly aerosol, and that we need to be wearing masks. And that's kind of the more important than, like, washing your hands constantly. And then, of course, learning about the actual risks of the virus to different age groups in particular. That's something that we've been learning more about through the year. And so as a journalist, like, I feel like I'm constantly having to kind of revisit what we know and kind of rework my own framework for thinking about the virus and how I report on it. And then the other bucket, I would say, is politics. And you alluded to this. It's already hard to cover a pandemic. Add to that the fact that we have governors that we've got on one side, we've got governors who have been a bit in denial sometimes about it. And then we have other governors who some would describe as heavy-handed in the response. And, it can be incredibly confusing as a journalist when you're hearing all of these different messages. And so it really requires you to constantly be taking a step back and try to sort of remove yourself from the messages on both sides to really think, like, what do we know about the virus and what are sort of the logical policy implications here? And I would say, like, we the right has clearly had issues with responding to COVID. We have COVID deniers, we have people downplaying the threat, et cetera, all of that. I think the press has done a relatively good job of covering that, and it's something that should be covered. But there's a similar phenomenon I've observed on the left where, it's a bit of a COVID paranoia to a point where people sort of can take, I would say, perhaps not evidence-based measures to protect themselves from the virus. And of course, we have consequences, right, from, like, all of the measures that we take. And there's, like, a lot of downstream consequences in terms of people's mental health, people's employment, things like that. So all of these things are really important to consider. But we have these kind of two sides. And as a journalist, the job is to take a step back again, kind of look at the messaging and then look at the science and find a way to somehow translate that to readers in a helpful way. And that's been a real challenge. And I will say I'm constantly questioning myself as I look at what I'm writing, how I'm writing it. And I think there have been times when my coverage has been right on. And I look back, over 2020, and then I think there are probably times that I've written something that, I go back and I'm like, I don't think I would have written it that way knowing what I know now. So, we don't do our job perfectly, but it's, it's that kind of like that's sort of, I guess, broadly how I would describe the challenge that journalists have faced over the past year.
So I've got two examples I want to use to sort of draw out where you're going with that I think are really valuable for talking about the challenge you face and how difficult it is for you to do your job. So let's talk about the first, hydroxychloroquine. Did I say that right? I always think I'm like, did I get that right? I think it was close.
I can't spell it, so if you're good.
So we spent a lot of time and energy trying to decide real or not, and this wasn't a slam dunk. I mean, there were relatively serious science people who were engaged in a conversation about hydroxychloroquine is something that is actually potentially a real treatment. I mean, how do you go through the evolution of going, okay, we've got to give this, there are people who are legitimate talking about it, till you get to the point that overwhelmingly you're now like, okay, no, it's not. I mean, what challenge does that present for you in terms of what you're presenting to an audience?
Yeah, I think one of the really hard things is that we have these political silos, and then social media makes it even worse. And there's just this constant pressure to kind of be either with the good guys or the bad guys. And with hydroxychloroquine, because of the things Trump said about it, and this was always an issue with like Trump, that all of a sudden he takes an issue, which maybe there were some things to be said about it, there were some positive, or at least it was a subject to be explored, right? And all of a sudden it gets put in this bucket of things that only crazy people pay attention to. And that's a real challenge, because I can tell you that journalists feel that pressure. If we write something, particularly with how siloed readers are right now, we have a particular type of person that likes to read the Washington Post. And if you write something that gets a lot of pushback from readers, all right, go out, buddy. Sorry. I'm sorry. I have a child here. Very quickly, and then you got to go back. I'm so sorry.
No worries.
But
we've lived this life.
Yeah. Come here. Say hi really fast. Say hi.
Hi.
All right,
Hey,
you need to go back.
Hi.
I'm sorry. My husband was supposed to keep my kids out of here. So, but yeah, I think like, that's really, really hard. I was actually just thinking, this white black thinking is a problem, right? And journalists are supposed to deal in shades of gray and nuance. And I think a lot of journalists, the pressure is to kind of, be in one camp or another. And sometimes the things that we say and report are sort of judged through this. Mm-hmm. There was a reporter over the weekend who had gotten the vaccine and had tweeted something about these negative effects that he was, you can feel like negative side effects, chills or whatnot after you get it. And he got really piled on for this tweet, just in sort of describing his own experience about getting the vaccine. And this was not to undermine vaccines. He wasn't making some kind of anti-vaccine point or anything like that, but got really piled on and had to apologize for that. And I think sometimes just the climate and the environment discourages journalists dealing in nuance, which is exactly what we're supposed to be doing. So, right, your point about hydroxychloroquine, I'm trying to think of like another example might be the lab leak hypothesis. Hey, great. I'm sorry. Hold on one second.
Take your time. Remember, it's not like you're So, Paige, I gotta ask. Better with us than like interviewing Fauci or Slavin on Post Live. Okay, don't worry about it.
I'm sorry. Yes. Okay, he should be gone now. So yes.
Let me turn you then now to the second. So hydroxychloroquine was a challenging one, but then but it became, I think, fairly definitive. An area that's not been definitive is the general area of risk. And particularly as it relates to schools. Now, Roanoke is a place that they're having to figure out how to make it work under these conditions. And, but then you move into elementary schools, high schools, and that, What challenges do you feel like you faced in trying to present the risk conversations fairly and accurately in an area where, I mean, even to this second, we're not clear on what risk is?
Yeah, Rodney, I'm so glad you brought that up because I've spent a lot of time thinking about that over the past year. And it's really, really challenging to talk about risk because, you know, people aren't, people are emotional in how they think about risk. And there are new risks and there are old risks, and coronavirus is a new risk. And so we tend to take it more seriously and perhaps not proportionally to what the risk is. We don't just like sort of dispassionately look at the numbers. I'm talking about the average person here. But yeah, with schools, I mean, I think if you read any Health 202s, you'll get a good sense of how my reporting has shaped around schools. But, you know, I started thinking a lot about this last summer when everybody was talking about what the school year was going to look like. And I was looking at what evidence that we had, and I wrote a number of pieces. One was actually, we had a pretty comprehensive study out of the UK looking at what happened to schools when they opened over the summer of 2020. They had opened up for a couple of months, and there was very, very little transmission in the schools. A little bit more, I think, in the high schools, but still extremely low. And, you know, I don't think there was that recognition here in the US at all. And I remember writing these pieces and we kept seeing studies come out, especially earlier this year. We actually finally had the CDC come out in January and say that transmission is very low in schools. These are not super spreaders. And I would say this is probably the most egregious area in which people haven't been able to calculate risk very well. In fact, the other day I was just double checking the numbers on the number of children under age 18 who have died of coronavirus. It's around the number of children who die of seasonal flu every year. And the CDC actually has a sentence on its website saying that the risk of complications from COVID-19 to kids is not as bad as the risk of complications for seasonal flu. And I just don't think that message has gotten out there a lot. And I think what's hard with the press is, like, particularly with health and science reporters, you know, we're immersed in this stuff, you know, kind of like public health officials. We're looking at the hospitalizations and the deaths, and you kind of get caught up in this, you know. And then we had all of these not all of these, we had a small handful of cases of this very serious syndrome that a number of children developed who had COVID-19, and we must have run a million of those stories about that in the Post. I'm not saying it's something we shouldn't have reported on, we certainly should have, but the takeaway that the public has from that, you know, if the public is sort of gauging their idea of the risk of the virus based on the media coverage that they're seeing, I think that the takeaway sometimes can be that the virus is more risky for kids than perhaps it actually is. And I think that goes to sort of, again, the responsibility of the press. I think we have a really, really important role here to play in trying to kind of be that go-between between, you know, the experts and studies and what we're learning to your average, you know, member of the American public who doesn't have time to like weed through all of this and is just looking for like an understanding of how they should change their behaviors with the coronavirus. So, you know, and obviously the school thing has had a ton of negative consequences, well-documented negative consequences for kids. But yeah, and I think the other thing is like, it's hard because you have to, you know, you need to put things in context for people. And I know that that's something that I've tried to do, but I think the pressure a lot of times is for reporters to not look as though you don't want to look as though you're minimizing something, right? Like you don't want to look as though you're downplaying a virus, which has been very serious and has killed a lot of people. But I think for me, like I've had to kind of, in a way, set aside my fear of what I think other people might think of me or my writing, and really try to just be as honest and straightforward as possible when I'm looking at the risk and really writing about it. Because everything is really complex, right? Like you know, people people need to be protected from the coronavirus, and they also need to be able to go to work and to school. And this whole thing has been really complex, and every single decision about lockdowns has lots of ripple effects. And so those all of those things have been very nuanced and very difficult to kind of report on and hash out.
And that then gets to, again, and risk is just such the perfect way to conversation to have. The challenge that you face is knowing that, for you, where you're trying to present all the gray of risk, that both sides are treated totally as black and white, and that they're going to, whichever, if you've this, you may be one of those cases where if you've done it right, everybody's yelling at you. The folks who believe that any risk is unacceptable risk, and those that are like, I need to go to work, this is, we are being too overwhelmingly risk adverse here, and that. But that you're not going to be able to please much of anybody when you write about it fairly.
Yeah, I feel like if mostly everybody's angry at me, then I'm probably doing my job. One recent example I'm just thinking of, and this actually goes to another issue I wanted to talk about, which is the issue of trying to forecast what the virus is going to do. This is another like trouble spot for journalists. But like when Texas and other states lifted their mask mandates, this must have been early March, I want to say like 2 months ago, we ran a lot of stories that were very foreboding and were like, we're all gonna, everyone's gonna die in these states because of at least we didn't write that, but that's probably what the takeaway sort of was from the tone of these stories. And really like piling on these governors. Now, not to say I'm not weighing in on whether or not that was the right decision or not. It may not have been, but that we haven't seen deaths go up, 2 months later. And I'm guessing that probably has more to do with vaccinating the most vulnerable people in the communities versus any mask mandates that were or weren't there. But it's funny because, I remember sort of being frustrated when the press was kind of piling on in that moment, because you're sort of predicting something, right? And you're not sure whether or not it's going to come true. And you're just kind of writing these predictive stories. And then at the same time, I had friends who were conservative who were texting me saying, oh, you need to like write about Texas and how the cases and deaths aren't going up. And at this point, it had been only a couple of weeks after they had lifted the mask mandates. And I'm thinking, well, if deaths and cases are going to go up, that's not going to be reflected for another couple of weeks. So it's really too soon to even say. And so that's a good example where you're sort of feeling pressure, I think, from both sides to write this like definitive piece on whatever you think about the effects of Texas's decision. And yet, as a journalist, I feel like the most prudent decision in that moment was to just take a step back and say, hey, I don't think I actually know yet. I don't think that I should be writing a story yet, diagnosing the results of, this decision. I think I would write that story now, like 2 months later, but sometimes we just need to like take a pause, take a breather, and wait until we actually have evidence so that we can report something confidently.
But it's people want to have a perspective with the evidence. I mean, they want to see Texas and Florida going to hell in a handbasket because it's consistent with their view. Michigan, they can't explain away Michigan because Michigan is supposed to have been more restrictive. And if you have a worldview to how you think the information should flow, when it runs contrary to that, it's challenging, isn't it?
Well, yeah, totally. I mean, I think the goal of journalists actually should be to surprise the reader, to find, to sort of be the person who finds that surprising angle or surprising story versus just trying to kind of fit into the mold of whatever they're expecting. And I think some journalists certainly have that perspective, but I'm not sure it's like totally pervasive through the industry.
Mm-hmm. So now, sort of shifting a little bit to the job. Okay, you produce every morning, it lands in my inbox. I go immediately to read it, see what you're on today. In terms of the hours of the day, are you up at like 3 a.m. cooking this? Time to make the donuts. I mean, how does it actually work? If you don't mind us, asking you to show us behind the curtain.
Yeah, I don't get up at 3 a.m. I like my sleep. So I actually work better earlier in the day. I'm not a night person. The Biden speech tonight is going to be really tough for me because I kind of start shutting down around 9 p.m. But yeah, I normally when I wake up in the morning, so I normally wake up around 6:30 or 7, and actually I already have pretty much all of the newsletter done the night before. And so all I'm really doing in the morning is looking it over, doing any final edits, making sure there was no breaking news overnight that I need to add, and then working with my editor to get it out between 7:30 and 8. And then I normally take a couple hours off, and then kind of hop back on around 10 or 11 and kind of think about what I'm doing for the next day. And so I really try to identify what I'm doing by probably midday. And then I try to get it done by 6. That doesn't always happen. I do find myself working in the evenings sometimes, but I try to keep pretty normal hours. And I do find with healthcare, I'm not usually writing about the news of the day, although that's been kind of different with coronavirus, obviously. But I typically can identify the day before, the midday before, and then we'll spend the afternoon talking to whoever I need to talk to be able to write my piece, and then I'll sort of write it late afternoon. So that's kind of my general rhythm. There's always kind of the random time that the random one-off where I have to totally switch what I'm doing late in the day. I remember there was the last fall, I randomly couldn't sleep in the middle of the night or something, and I'm like on Twitter at 1 a.m., which I'm literally never on Twitter at 1 a.m. And it just so happened that it was the night that Trump tweeted that he had the coronavirus. And he tweeted this around 1 a.m. It almost felt like a divine intervention or something that I was actually up to see the tweet. And so I ended up staying up most of the rest of the night, rewriting my talk. So I was like, okay, the president has COVID. We should that should probably be the top of the newsletter. So, but that usually doesn't happen. I guess the other time is that I stayed up really late was when the Senate was voting on the skinny repeal and replace back in 2017. Yes. And I remember that, and the thumbs down, I think, was around 2 a.m. or something. Oh, wow. And I remember working till 4 and then sleeping for 2 hours and then getting up again or something but yeah, I normally like my sleep, so I protect that pretty carefully.
Yes. So where do you get the story ideas from? I mean, do you feel like they are that the news of the day drives much of it, or how much are you out there sort of wanting to beat the bushes to find the things that you think are interesting, that you think the readers are going to want that the readers will find interesting?
Yeah, well, I definitely try to not always take my cues from what is the narrative of the day, because I want it to be something that's different and useful to readers. So I don't know. I feel like I just sort of absorb story ideas throughout the day. And a lot of times it comes from just conversations with people. I've been covering health policy now for a decade. And so I know a lot of lobbyists. I'll just, if there's an issue percolating, I'll call up a hospital lobbyist or a drug lobbyist. Hey, what's going on? What are you watching on the Hill? The lobbyists know everything, as you know, Rodney. They know everything that's going on in this town. If you wait for the comms people on the Hill to tell you what's going on, you'll be the last person to know. So the sooner you learn that, the better. So just talking to folks, I listen to a lot of podcasts, I read a range of news sources. There's a couple lobbyists that actually put out really, really good notes on what's happening on the Hill and kind of policy analysis. And then just hearing from, activists. So I guess, yeah, it's really from a mix of just reading, talking to people, and then the occasional tip, that you find in your inbox. And a lot of times there will be just kind of broad themes that interest me, and I'll find ways to kind of dive into them. I was trying to write about the how the virus had really gone through nursing homes last fall, and ended up connecting with a woman whose mother lived in a Maryland nursing home. And so it sort of turned into the story about how this nursing home had not been handling it very well, but then kind of was an example of kind of the broader devastation that we've seen among the most elderly Americans from the virus. So
I'm going to show off some ignorance here, and I hope you will forgive me. I am a Post subscriber, but I don't read the Birdcage edition very much. You are almost exclusively in the digital world, right? I mean, how often do you end up in the print version?
Yeah, well, it's mostly just digital. They did have a page reserved in the newspaper, in the print, believe it or not, newspaper for a while, that was devoted to the newsletters. And so if I had a particularly good top, especially one that was evergreen,
Right.
they would end up putting that in the print edition. But I think they discontinued that about a year ago, because the news was just changing so fast. And particularly, like, I know I was writing about COVID every day. And so, normally there'd be like a delay of like a day or two to get in the newspaper. And I think they were finding that by the time they actually ran it in the print edition, things had changed so quickly. And so they don't do that now. When I first started the job, of course, I started in the middle of repeal and replace in 2017. And so I would do a lot of teaming up with like Congress reporters to cover that. And so I would get print stories from that. But right now it's digital. But to be honest, we don't really think about that very much. Like, I was thinking recently I should actually get the Post delivered to my house. I don't even get it delivered to my house, which is, I shouldn't even admit that, but I was realizing that my kids don't even know like what a newspaper is. So I may like actually find a way to bring it to get it to my house so that at least they can see like what I do.
I don't, but every time I get the bill to send to Jeff Bezos, I'm like, hey, Sil, do you want that? No, my wife desperately reads these. So yes, we have a difference of opinion in the house on that. So yeah, so it's this interesting world where you're a newspaper reporter who's almost never in print.
Well, yeah, right, exactly. I know. And if people ask me, I guess I do say I'm a newspaper reporter. But no, and it's funny how little I think about it. I mean, I think probably so many generations before me would think about, is my story going on the front page? Now it's, if my newsletter makes it onto the front, the web page, that's what I count as like a win these days.
Yeah. And that's definitely how it goes. So let's pivot a little bit just for, this is obviously, part of a college conversation with young people around here. Talk about your pathway from, so I didn't do a significant intro because I wanted you to do that as part of it. Talk about where you went to college, sort of your pathway from being where these kids are to now where you are today.
Yeah, well, I guess I first got interested in journalism in high school. I couldn't tell you why, because my family never read the news ever. But I remember sort of thinking, as you do when you're in high school, journalism sounds exciting. I can be in the middle of everything. That sounds great. And so I ended up going to Wheaton College, the one in Illinois, not in Massachusetts. They did not have a journalism program there, but I did start working on the school paper. So that's really where I learned how to write a news story. I was a reporter first and then a features editor. And it was really through a friend there that I was able to get my first internship. And that was right after college. And that was at the Naperville Sun. Naperville's a small-ish town in the suburbs of Chicago. And that was really where I cut my teeth in it. And I kept myself really lucky because this was back in 2006 and no newspapers were hiring. I think I was the last person that got hired there before we were owned by the Chicago Sun-Times. They filed for bankruptcy that year, but it just so happened that they had a spot for me. So I did this internship. It turned into a job. And I covered the county government became my beat. So I covered DuPage County, which is the second largest county in Illinois. And I would go to the county board meetings, Tuesday mornings, Tuesday nights, cover zoning issues and all kinds of stuff. And I'm so nostalgic for those days because you just learn how to cultivate sources, write about things without a lot of a spotlight. Like your average person doesn't care like I mean, people in Naperville cared what we were writing about, but like it wasn't flashy or glamorous at all. And sitting through like 4-hour long, county board meetings and city council meetings and trying to figure out, what you should report out of it. And so I really loved that. And I found that it really suited me, and my personality and what I really wanted to do and sort of the way that I felt I could improve the world. And so I did that for almost 3 years. And I really realized, though, that if I wanted a long-term career in journalism, I probably would need to make it out to DC or New York, seeing the way that things were going. And, it's hard to break into those bubbles if you're outside of them. So I had a sort of a period where I was applying to stuff. You never get a call back. You don't live there. Like nobody wants to hire you. So I eventually ended up taking a job for a nonprofit it was sort of a startup type of a thing. And they were trying to send investigative journalists to state capitals. And so they wanted to hire somebody to cover Richmond. And so I took this job, and the nonprofit was a bit chaotic and a bit of a mess for a lot of reasons I don't need to get into, but it did give me some experience. It got me to the DC area, got me some experience covering Virginia state government, which is what I needed. And actually at that job, it so happened, and this is really, as you know, how every job goes, it's the contacts you have and the people that you get to know. I ended up working with a guy who had worked for the Washington Times. He ended up going back to the Times. He recommended me for a job there. So I was able to hop over to the Times, covered Virginia state government, and then got promoted to their Congress team. So that's how I landed on Capitol Hill. And then the rest is kind of history, to be honest, because this was 2011 when I got promoted to the Congress team. And of course, this was the year after the Affordable Care Act was passed. And I remember the day that my editor sat down with me and he said, "I hate covering healthcare. You're going to cover it." This was our bureau chief. He had been up there forever. And Stephen Dinan, he's a great guy. He wrote about everything. But he hated healthcare. And so he told me I was going to do it. And so I remember being not very excited about that because I had no interest in healthcare and was very healthy at the time, had no chronic health conditions and had no interaction with the healthcare system, couldn't care less about it. But, your bureau chief tells you to write something and, you do it. So I started hopping on all of the calls that CMS and HHS were doing, rolling out rules. Didn't know anything about the rulemaking process. I kind of laugh at some of the questions I used to ask because it just not a clue. But that's really how I started learning about Medicare and Medicaid policy and the marketplaces. And I just learned by doing it. And then of course the ACA turned into the political battle that never ended. I think it's like sort of kind of maybe ended now. I'm not sure it ever will exactly, but I covered all the repeal votes in the House and all the politics around that. And so that was actually what helped me kind of then step from publication, sort of make my way up, if you will, through the DC stratosphere of media companies. So from the Washington Times, I went to Politico and did that for a couple of years. Then I went over to the Washington Examiner and also covering health policy. And then it was right around the time Trump was elected, I got an email from an editor at the Post, and they were looking to start these policy newsletters. And so they asked me if I was interested in coming on board to start a health policy newsletter. Of course I was, it being the Post, and interviewed, came on board, I guess in March 2017. So it's been about 4 years. And then we launched Health 202 in like April or May. And it was really great timing, of course, because it was in the middle of repeal replace effort by Republicans on the Hill. So it was super buzzy. And I think it was a really good way for us to quickly grow our subscriber base and just like hit the ground running with it. And I've been doing that ever since. And it's been a ton of fun. I can't believe it's been 4 years. Really, I guess through the whole Trump administration. So that's kind of like
So
where we are now. But it's been great. It's been a lot of fun.
So for those of you who will be reading this tomorrow, for those of you who don't already, you have a tagline in there. Remind me, it's oof and ouch and ah.
Oh,
Who came up with those? Are you taking credit for it? And somebody hoist that upon you?
I don't know if I want to take credit for it, but yes, I'm the one who came up with those. So when we first started the newsletter, we had like all of these like different sections. We used to have like one that was like about research or studies that came out. One was like health on the Hill, health of the administration or whatever. We've since eliminated most of those because we've realized people don't really care about sections for the most part. They just want to like read the content. But oof, ouch has existed and persisted through all of it. And it's funny because like I originally intended for it to be just these kind of like weird stories that stood out, but it's actually kind of now turned into like, these are the top stories. And then it sort of raises the question of whether you're editorializing, because if you put a story under oof, are you sort of making a statement about whether you think it's good or bad? So it sort of led to all these conversations between me and my researcher, but people seem to like it still. So we're still doing it.
So we're going to open up to questions in just a second, but I saw one fly through already. So let's do this one, and then we'll open it up to the crowd here, which is I read the post, and when I get done with your story, there's that place where people are allowed to comment. Do you ever go to that hellhole yourself, or do you keep clear of that?
I do not spend a lot of time reading comments, much as I do not spend much time reading responses to my tweets. I have found that they are it's not a great time, not a great way to spend my time. If you have a comment about my story, you can email me and I will read that and respond. But yeah, it's not usually helpful. So people can do what they want on the comment section, but I've got better ways to spend my time.
Yes, I will scroll, but I will occasionally scroll down just to see how people are reacting, and then I spend a couple seconds. Oh, no, that's why I never do this. So yes, I hear you. All right, friends, bringing in our august faculty here, and where would you guys like to go tonight with us?
So this has been a lot of fun. It's fun to get the journalistic side. My training is as a sociologist, and really journalism and sociology are cousins in some way. We're trying to open up the conversation, get away from what we take for granted. And like you said, tell the story that's maybe a little bit of a surprise. So I loved hearing you talk about that. I have a couple of questions that I want to start with. I'm hoping we'll get some more from folks who are watching. We have a great audience. So one is a kind of basic journalism question, and that is, how much does audience drive the topics you choose to focus on? So you write for the Post. You know who reads the Post. I read the Post every day. I grew up in Northern Virginia. So I don't mean like what your findings are, but the topics that you choose. How much are they driven by audience?
Yeah, that's a good question. One of the things that I have to think about is who the targeted readership is of the Health 202. And to be honest, my editors haven't ever given me like a great answer on that. I guess I think of the reader that I keep in mind is like, for example, last year, there were a ton of debates about Medicare for all in the Democratic debates, right? This came up every time. And I think like, I'm writing for the person who is interested enough in politics and policy to watch the debates, to like tune into them, but doesn't know enough about healthcare to really understand the nuances between what Kamala Harris is proposing versus Buttigieg versus somebody else. And so I think I'm like, I'm explaining to that reader. So that's at least in my head. And, there's always the question when it's actually honestly very difficult to decide what to focus on, because I have 5 newsletters a week, and it's not hard to like find something to write about, because in health policy, there's like 50 things I could write about in any given day. It's more like how am I selective? What am I choosing? And I have found, and I don't go just by like open rates on my newsletter or whatever, or like those kinds of metrics. But I have noticed if I write something really niche on like Medicare or Medicaid payment policy, there's going to be a certain subset of people who really like that, but a lot of people like aren't going to be super interested in learning the details of like this Medicaid waiver. So I will say I've sort of tended away from those things a little bit more in recent years, and a little bit more towards what is that thing that Trump or Biden said about healthcare yesterday, and how can I find an angle to that or explain what they said? With COVID, that's been relatively easy because you're writing about COVID. Everyone wants to hear about COVID. Everybody's interested in COVID, and so you're just kind of like figuring out what's your niche there, and like what's your angle for the day, or what part of the pandemic are you covering? But yeah, I mean, I think it's really hard, but it's something I like try to keep in mind. It's two things, right? It's like, what do my readers want to hear about? And it's also, what should my readers hear about? And it's kind of like balancing those two things. With Trump, do Washington Post readers want to hear about his stupid tweets all the time? Yeah, they do. Do I write about his stupid tweets a lot of the time? Yeah, I do. Do I eventually get tired of writing about his stupid tweets? Yes, I do. So, that like, you're sort of like, I guess, balancing those two things. You want a lot of readers interested in what you're writing, but you're also like, okay, guys, we know Trump tweets. Like, let's do something fresh for tomorrow. So does that kind of answer your question?
It does. And it actually leads, I think, really well into my second question. And I know Brian has a question, and then we have another student question queued up. So my second question was really about something you talked about in terms of the way in which the audience can actually sort of demand lack of nuance. They want all one way or all the other way. And I think about pieces like Michael Osterholm and Neil Kashkari wrote this amazing op-ed in August about the way in which the way that we have dichotomized the economy versus health in the COVID debate was so damaging, and that actually we needed to bring those things together. And every time I asked people what they thought about it, they would take a sort of position of, well, no, it's really one or the other. And so I wonder if, as somebody who was trying to do the same thing to bring some nuance back in, how hard is that? Who do you connect with to make the conversation a smarter conversation?
Yeah, that's such a good question. It really is hard. And I will say, journalists do respond. I don't think we should, but we do respond to incentives, and we tend to respond to how people respond to our pieces. Like, I know that if I write a piece that's like trashing Trump and his response to COVID, I'm going to get so much positive reader feedback. And like, that makes me feel really good about what I do. But if I write a piece that like kind of challenges like the left's narrative, I'm not going to get as good of feedback. But it's really, really important. Like, for me, like, I don't feel good about my work if I just feel like I'm feeding into one narrative or the other. And you make a really good point, and I think is spot on, about how people would either focus on the negative effects of the economy or on the health effects. And as a journalist, you're trying to kind of like occupy that middle space in between. And I guess like one way you can approach it is like within the piece, you can try to be really nuanced. And then also when you're thinking about the scope of your coverage, you can just make sure that you're writing about like a variety of topics. Like I spent some time writing about, the effects of COVID in nursing homes, and just the horrible, like just what was happening there and how horrible it was. And, the fact that like COVID was the second leading cause of death in January and February. Like, you just can't downplay that. Like that was a reality. And yet I also remember last spring writing about the serious concerns about substance abuse increasing and the opioid crisis. In fact, I just revisited that topic a couple of weeks ago. We have some estimates that opioid abuse like skyrocketed in 2020. So I think just kind of like showing the reader that you're taking like a really broad lens and you're looking at like all of these things and you're trying to like evaluate all of these effects just versus just kind of having this like narrow tunnel vision. And then also like being willing to like, you know, a lot of times you're tempted to be in one camp or the other, but being willing to like question your narrative, question your assumptions. Like, I was thinking I should write something about, it looks like suicides actually didn't go up last year, like thankfully, which is great. But like, that was one of Trump's lines. He's like, suicides, everybody's killing themselves because like lockdowns, blah, blah, blah. And it was like, I actually, at the time I thought, well, that seems plausible. Like maybe we are going to see the suicide rate go up. Well, looks like we have evidence that actually didn't go up. Well, I don't think you're going to hear a lot of like conservatives, like, you know, like writing about that because they want to like emphasize, like it's, you want to emphasize like the negative effects of the lockdown. So I just think like being willing to like write that story that challenges like your underlying beliefs and assumptions. And I hope that comes through to my readers. And sometimes when I write a piece that I know my readers aren't going to like, I just do it anyway because I feel like it's the right thing to do. So I don't know. People hate me and I don't know. That's fine, I guess. I think if you're a journalist, you just like can't care too much about like what other people think of you. I think that's important.
And you're actually getting at some of the questions our students are asking in the comments. How do you remove emotion? How much do you respond to the general audience and general public opinion? And I think you're responding to all of that. So thank you. Brian, I know you had a question too.
Yeah, I do. Yeah, it's been great so far. And Paige, you mentioned that you have been covering healthcare policy for about a decade or so. And so my question is, how have the major issues in healthcare changed in that time? In other words, how has the conversation about healthcare in the United States evolved from the time you started kind of right after the passage of the ACA to today?
Mm-hmm. Yeah, well, I mean, in a way, we're kind of still dealing with the same fundamental problem that we were dealing with when the ACA passed, which is that we still don't have universal coverage. And the ACA it improved that, of course, but didn't fix it entirely. I mean, I guess like there's definitely more recognition of healthcare as like just a problem for the average American. I think one really great thing that journalists have done over the last decade is really shed light on the systemic problems with health insurance. Sarah Cliff at the New York Times now, I couldn't say enough great stuff about the work that she did on like emergency room bills. And, through her work, there was a growing recognition of the problem of surprise medical bills. So I think people have really recognized like, okay, even if you have health insurance, it doesn't necessarily mean that it's good health insurance. And so that's a conversation I think that's happening now that didn't happen previously. And then of course, this total Republican embracing of the idea, and Rodney, you might have thoughts on this, but of the idea that people with pre-existing conditions should be protected and should be entitled to coverage. And that's not an idea, I don't believe, that was really widely accepted among Republicans if you look back to like the 90s and early 2000s. And yet because of the Affordable Care Act, it became an issue that Republicans politically had to embrace. So like in one way, I think that healthcare has become more politicized, and it's really hard because both sides have kind of backed into these corners. It's hard to see a lot of things really constructive happening. But also in a way, I think that in a way, Republicans have moved sort of, there's some recognition among Republicans of, I guess, the ongoing problems in healthcare that maybe there weren't before. But, we're also in a place where like we passed this sweeping healthcare law, and yet we still have like 30 million Americans without health coverage, So I think it's kind of frustrating to a lot of people. And then of course, the conversation around drug prices too, especially brand name drug prices, that's something that I wasn't hearing. I mean, that was being talked about when I started covering it, but I think it's just become like a really big conversation. There's been a lot of attention on it. So Yeah, it's been a fascinating time to cover healthcare, that's for sure, because you've always had like the really interesting policy elements and then obviously very divisive politically.
Throw one at you, Paige, just real quick, that if you're talking about the crazy breakneck pace that we've seen healthcare policy evolve, the president tonight is going to propose $200 billion in new subsidies for the ACA. Not a criticism, just statement. That didn't lead your coverage this morning. I mean, that's unbelievable. And it's because you had something else to write about, but it was that I think actually was a bigger grab, which is, but he's not talking about drug pricing. But the idea that now $200 billion in new subsidies to back up the ACA is like not the only story right now. It's crazy to me.
No, I mean, you're right. You're right. Yeah, it's funny. Well, I'm kind of mad about the whole drug pricing story because I had spent like weeks writing about how this was going to be in the plan, which everybody thought it was going to be. And then, and then I started hearing rumblings a week ago that it wasn't going to be included. And of course, the New York Times beat me to that story, which was annoying. But, it became clear they weren't including it. So then that ended up being the story. But no, you're right. Like, I mean, like rewind 5 or 6 years ago, and like Republicans would be screaming bloody murder about this, like, but we're not hearing anything. But that's partly because we're like living in this strange new world where we have just so many bigger fish to fry. Don't worry though, I will have a lot of mention of it in tomorrow's Health 202. So never you fear.
So I'm looking forward to reading that tomorrow. One last student-oriented question. So if I have a student in my Intro to Public Health class who is listening to you tonight and saying, that sounds fantastic. What are your thoughts on first steps? Are they in that kind of local journalism, or is it getting more training on the healthcare side to be a health journalist? What are your thoughts?
Like if they want to become a healthcare journalist?
Mm-hmm.
Well, I've often wished that I had some kind of formal training in policy or science or something, but I really just my college degree is in history, which is just because that was easy. But so I'll be honest. So I would say, like, if you want to get into journalism, the key honestly is to just start doing it. So like finding a way to just start publishing pieces. Like I will tell you that that like your average editor doesn't really care about credentials. Like I feel kind of weird being in DC, having never gone to grad school, but I have never once felt pressure to go to grad school being in DC. And I think that's probably unusual. I'm guessing that's unusual for like an industry here. But it honestly is like about, are you a good writer? Are you someone who can like process information really well? And are you curious? Like, and do you have like published clips to like show editors? You have to be able to show an editor that like you can write and you can report. So like, I wouldn't actually really advise a wannabe reporter to necessarily go to J school or like do a public health program. I would actually advise them to just like start freelancing, like go to a publication, I don't know, like a trade publication or something, I don't know, or even or try to freelance something for the Post or some like online publication and just like pitch some ideas and start writing pieces and getting them published and like start going to like health policy happy hours and getting to know people. That's really like how you do it. Get to know health reporters, get to know who the main players are, who the main reporters are. Send them a note, get them like attuned to your work. Like you basically just need to get like reporters and editors like paying attention to like what you're writing. Editors are like pretty lazy when they hire. They just want to find like, I don't know, they want to hire like known entities. And so I just think like you have to have like proof that you can do it and like published work. That's what I would say.
Great, thank you. It's always good to know there are different pathways, and our students don't have to immediately make that grad school choice, which doesn't always work for everybody, and that's okay.
Well, and you don't earn enough in journalism to pay off grad school. So.
Hey, I know we're at the bottom of the hour. Can I throw one more out, sort of pulling off the question on there? Paige, how do you see healthcare changing coming out of the pandemic? I mean, one of the obvious areas is telehealth. I mean, how do you see what we've been through affecting where we go?
Yeah, I mean, I don't know. I'm so bad at predicting things. I don't really know. I mean, the thing I'll be watching this year will be now whether like the fact that Biden is pushing for this like subsidy expansion, whether that's going to be what they count as like did they do their job? Did they fulfill their promises on healthcare through doing that? And are they going to continue push, is there going to be a push for anything else to happen before the midterms? I don't know that there will be. We still have the savings from HR 3, which could be, useful in future reconciliation bills. But I think like there was so much focus among Democrats in the primaries. Like it was like every debate was like, you remember the first hour was spent like debating how to expand health insurance. So I don't see this fading at all. I think it really is going to be about how do you kind of close that gap on the 30 million uninsured people, and what does that look like? The thing is too, like you can actually cut that in half if you just get people to enroll in Medicaid and subsidized marketplaces that they're already eligible for. So we're actually a lot of the way there already without necessarily adding a public option or something like that. But yeah, I mean, it's always going to be there. And I think Democrats have made this a really high priority. So apparently the White House is feeling a lot of pressure to like do something on drug pricing. So the HHS spokesman told me that Biden is going to call on Congress to move on HR 3 tonight. That's his that's his response right now.
Go Hamlet.
Yeah. But I don't know if anything better than that than that to add, really. I didn't think the pandemic was going to be a pandemic. So, I mean, I don't trust myself on any kind of predictions. I thought the Obamacare wars were going to die down before they did. So,
You and me both.
Well, thank you to Rodney and Paige for this conversation. It's been fantastic, and we really appreciate you joining us tonight, Paige. And thanks to everybody who joined us tonight for the NOKELive event. Please visit the alumni page at roanoke.edu/alumni for all events that'll be upcoming, both virtual and at some point eventually in person. So thanks everybody. Take care and stay well. Bye-bye.
Night.